Welcome to NCLEX RN exam practice test. Our topic today is psychosocial integrity. Use the link in the description to download the app on the App Store for free practice tests. Number 1. A 4-year-old is taken to the emergency room by his parents for a dislocated shoulder. The parent reports that the child fell when playing football. However, the nurse noticed that there were fading bruises all over his body, and he did not make eye contact or reply when asked about the bruises. Which of the following actions by the nurse is most appropriate? A. Treat the child as usual. B. Report to appropriate authorities. C. Ask the parent to tell the police. D. Refuse to treat the child for suspicion of domestic abuse. The correct answer is B. Report to appropriate authorities. Explanation. The nurse's role is to identify, assist with treatment, and aid in the prevention of abuse and neglect. It is the nurse's duty to report suspected neglect or abuse to appropriate authorities. The parent said their child feels when playing soccer, but his fading bruises along with his behavior makes the story suspicious. Because the injuries may be the result of child abuse, the nurse must make the report to the police department. Number 2. A nurse is taking care of a patient who has just been informed that she has cancer. She tells the nurse, "I ate before the blood was drawn, that's why the result is wrong. We should test again." Which coping mechanism is the patient using? A. Denial. B. Projection. C. Regression. D. Rationalization. The correct answer is D. Rationalization. Explanation. Coping mechanisms, also known as defense mechanisms, are ways that an individual responds to increased stress or a crisis in order to process the event and maintain their psychological integrity. In this situation, the patient is using rationalization, meaning that the client explains away the event with faulty thinking rather than dealing and coping with it. Number 3. A Jewish patient who follows kosher preferences asks a nurse to order him lunch. Which of the following meals should the nurse choose? A. Roast beef with whole milk. B. Oven-fried breaded chicken with a fresh lettuce salad. C. Pulled pork with creamy slaw and apple juice. D. Cheeseburger with lettuce, pickles, and French fries. The correct answer is B. Oven-fried breaded chicken with a fresh lettuce salad. Explanation. Kosher is a term to describe any food that complies with a strict set of dietary rules in Judaism. One of the most important rules of kosher is that a person should never eat meat and dairy together. Kosher diets avoid the consumption of meat from pigs, predator or scavenger birds, beef hindquarters, and shellfish. All fruits and vegetables are considered kosher. Number 4. A nurse is taking care of a male patient who has been amputated after a motor vehicle accident. The patient does not respond to the nurse's questions. He just stares at where used to be his leg. The nurse says, "Living without a leg will be frustrating, I can imagine, but we have some ideas that could be helpful or even help you walk again like a prosthetic leg." What is the nurse expressing? A. Empathy. B. Sympathy. C. Respect. D. Active listening. The correct answer is A. Empathy. Explanation. Empathy is the process of understanding another person by identifying with his or her situation rather than seeing it from an outside perspective. It involves putting oneself into another's shoes and seeing the situation as the affected person does. When used in a helping relationship, the counselor can utilize empathy by trying to see the client's viewpoint and consider the situation from the client's perspective rather than the counselor's. Number 5. A 12-year-old patient who was sexually abused at age 10 comes to the hospital for her monthly mental check, but like the last time she came, she still cannot remember the incident. Which coping mechanism is the patient using? A. Projection. B. Displacement. C. Repression. D. Reaction formation. The correct answer is C. Repression. Explanation. Coping mechanisms, also known as defense mechanisms, are ways that an individual responds to increased stress or a crisis in order to process the event and maintain their psychological integrity. In this situation, the patient is using repression, in which he excludes unwanted or unpleasant experiences, emotions, or ideas from conscious awareness. Number 6. A 35-year-old male patient is admitted to the emergency department for injuries in a car accident. The patient is a member of Jehovah's Witness. What should the nurse consider when taking care of the patient? A. The patient's food preferences. B. The patient's refusal of blood transfusion. C. The patient's requirement of personal space. D. The patient's requirement of body contact restrictions. The correct answer is B. The patient's refusal of blood transfusion. Explanation. A patient who is a Jehovah's Witness will often refuse blood products, so special planning will be necessary for these patients when they undergo surgery or other medical procedures. Number 7. A nurse is taking care of a patient whose husband died 3 weeks ago. The nurse observes that the patient does not respond to the nurse's question and always stares at nowhere. Which phase of grief is the patient in? A. Denial. B. Anger. C. Bargaining. D. Depression. The correct answer is D. Depression. Explanation. Kubler-Ross is famous for her 5 phases of grief, the process that people move through when losing something important to them, including the loss of a loved one, successful job, or even body image changes. In this situation, the patient is experiencing depression characterized by loss of interest, feeling that life is not worth living or fatalistic, withdrawal from friends or family. The nurse should offer support and do not try to prematurely pull her out of grief. Number 8. Which type of mental disorders involve physical symptoms for which no specific physical cause is present? A. Anxiety disorders. B. Personality disorders. C. Somatoform disorders. D. Dissociative disorders. The correct answer is C. Somatoform disorders. Explanation. Somatoform disorders involve physical symptoms for which no specific physical cause is present. The disorders include hypochondria, somatization disorder, conversion, and pain disorder. Treatment is more management than cure and may or may not include medication. Number 9. A nurse is taking care of a 20-year-old client diagnosed with bipolar disorder. When she is in the manic phase, which occupational therapy activity is most appropriate? A. Rest and sleep. B. Write a journal. C. Solve crossword puzzles. D. Go camping in the park. The correct answer is D. Go camping in the park. Explanation. During a manic phase, the patient has high levels of energy, so physical activity, such as hiking, camping, biking, or a sport, is appropriate. Other symptoms of manic phase include overly inflated self-esteem, decreased need for rest and sleep, irritability, distractedness, physical agitation or aggression, provocative or destructive behavior, increased talkativeness, excessive high or euphoric feelings, increased sex drive or energy level, denial, uncharacteristically poor judgment. Number 10. A Mexican mother takes her 2-month-old daughter to the emergency department. The child is presented with a fever of 38.5 Celsius degree with signs of sepsis. The physician orders a lumbar puncture, but the mother refuses until her husband arrives. What should the nurse do? A. Try to contact the husband. B. Report to appropriate authorities for suspicion of child abuse. C. Contact social workers to intervene. D. Perform the procedure anyway as the child is in danger. The correct answer is A. Try to contact the husband. Explanation. In some cultures, Mexican, Asian, and Middle Eastern, major decisions are made by the males or the head of the family. So, the nurse should keep trying to reach the baby's father. Thanks for watching. Don't forget to like, share and subscribe to our channel for updated videos every week.